Hello, everyone, and welcome to the live discussion of firefighter physicals brought to you by the National Volunteer Fire Council. I'm your host, Kevin Quinn. I'm the first vice chair of the council and a board member from Rhode Island. I'm joined today by Dr. Brittany Hollerbach, associate scientist and deputy director of the Center of Fire, Rescue, and EMS Health Research, Dan Carrigan, director at large at the International Association of Fire Chiefs Safety, Health, and Survival section, and author of the best-selling book, Firefighter Functional Fitness, and Rick Klein, retired fire chief and national speaker of Firefighter Health and Safety. For those of you who may not know, February is American Heart Month, and it's a perfect timing for us and the firefighters and EMS providers to focus on their health. Today's discussion will focus on why annual firefighter physicals or annual medical evaluations are essential to respond to health and safety, how firefighter physicals are different from regular physicals, how departments can implement a physical program, and options for firefighters who don't have a department-wide program. But before we jump in today's discussion, I'd like to take a few minutes to let our panelists introduce themselves. Brittany?
Hi, everyone. Thank you so much for having me here today. I'm really excited to talk about firefighter physicals. My background's in the fire service. I was a firefighter for 4 years before I went back to school. My degree is in kinesiology, which is exercise science, basically. So I'm really interested in how exercise and physical activity impact the body and can keep it healthy and safe.
Great. Dan?
Hey, thanks for having us. I really appreciate the opportunity. In addition to what Chief Quinn said, I'm about a 36-year veteran of the fire service, recently retired fire chief outside of Philadelphia here, and just, all about firefighter health and wellness and trying to do the best I can along with this great group and a lot of others to improve that across the country and the world, really.
Great. Rick?
Hey everyone, Rick Klein here, and thank you to the National Volunteer Fire Council for having this and hosting it. This is a phenomenal thing that you all are doing. I began my fire service career in 1978. So let me just dispel one rumor in that I did not know Benjamin Franklin. However, I have spent 40 years in the fire service, and 1992 went to Minnesota and became the career fire chief in Plymouth. And that's where I retired from in December of 2015, so 23 years in Plymouth. It's a great opportunity on a great subject.
Great. We have some great subject matter experts, and I want to thank all of you for being here today. Today's discussion will last about an hour, depending upon how many questions we will receive. And just if you do have a question, just put them into the chat box and we'll monitor that and we'll get to them as we can. We're really taking questions from you, the audience, and want to make sure that we leave you with information that helps you make final decisions. What we'll do is, with that, let's begin with a personal story of mine that may open your eyes just a bit about the importance of annual firefighter physicals. In 2016, when I was the chairman of the NVFC, my health, safety, and training committee had just come off of a quest that they wanted to reduce the line of duty deaths, and looking at those numbers, in 2016 early, they looked at something that jumped out to them, and that was personally owned vehicles. There were too many deaths with usually young male drivers rolling over their personal vehicles, going to a call, going to the station, or even coming back. So they put together a campaign, and the Health, Safety, and Training Committee rolled out educational formats through the iChiefs and through all the organizations, MVFC and International Association of Firefighters as well, because we did find that the education and getting folks to slow down and put a little bit more focus on the trends of line of duty deaths in POVs, and there was a difference, and they felt good about that. The Health, Safety, and Training Committee for the MVFC just had a nice feather in their cap, and then they came to me again in 2016, in June of 16, and they wanted to do more in reducing line of duty deaths, and so then they looked at the number one at the time killer of firefighters in line of duty was cardiac. And so they wanted to redo, and that, to me, it's like, well, I'm wondering, how is this Health, Safety and Training Committee going to reduce cardiac events? And they tackled it. And during the process, they were looking at firefighter physicals, and they were taking a position statement that all firefighters should have an annual physical. To do that, we had to look at all aspects, and money is certainly a challenge for many volunteer fire departments. So they came up with a tier system. And the tier system was going to be, that the gold standard of 1582 would be the top level, and then there would be a modified 1582, and then there was a DOT, Department of Transportation physical, and then finally it was the Affordable Care Act, where you get that one free physical. And so during that process, I went down to North Carolina to evaluate a company that Chief Cash from Cherryville Fire and Rescue had recommended. So I went down along with one of our staffers, and I participated in a firefighter physical where they rolled in the equipment, they set up stations, and they turned Jeff's training room into an assessment lab. And I participated in the physical, and then we were meeting with the executives of the company, and Jeff Cash, Chief Cash, is medical director, and we're in the meeting after I participated in the physical, and the doctor knocks on the door and asks me to step outside. And so we go into the bay, and I'm actually leaning against one of Jeff's ambulances, and the doc's got my EKG strip in his hand. He's concerned about what he's seeing. And I asked him, I said, well, is it to the point where you need to put me in this rescue and Jeff has to transport me? And he said, no, but, and when he said that, I never had any signs or symptoms for any cardiac issues. I felt fine. I discounted what the doctor said to me, and I went back into the meeting. Well, a few minutes later, the doc knocks on the door again and pulls out the owner of the company. And that owner, and they violated my HIPAA rights. I know they did out there, but they're talking about the situation of the concern the doc had about me. And then they brought me out into the conversation. And first thing that Charles asked me was, would you waive my HIPAA rights? And of course I would. And then Charles said to me, I've read over 200,000 of these EK strips for firefighters. I've been doing firefighter physicals for over 30 years, and you're going to need a stent or two in your heart. Well, he got my attention. And at that point I said, well, can we send these results up to, my wife works in a hospital. I want a cardiologist to read it and see what they have to say. Well, we did. And within an hour of me being on that EKG result, the cardiologist read it and said, well, I don't know about the stents, but we certainly need to do further testing with this result. And after a couple of months, because I wasn't an emergency case, I had no signs or symptoms. But after a couple of months, I had, some other tests done, a nuclear test. I had a cath lab, and I'm in the cath lab, and I'm looking at the monitors, and I have no idea what I'm really looking at. But I said to the doc, I said, and I knew the doctor, and I said, Doc, how are we doing here? And I could tell by the tone of his voice in that moment in the cath lab that things were not good. He said, Kevin, we'll talk about it later. And well, after that cath lab, I went in and he came down and he advised my wife and I that I needed quadruple bypass surgery. Now, I'm a pretty healthy guy. I don't smoke, I don't drink. I try to eat the right things. I exercise regularly. I had no signs or symptoms, but here I am now. I'm faced with this quadruple bypass surgery. And, I for 5 minutes was like taken back, and then you pull your bootstraps up and then you believe in the system. And the system works because it was early intervention. It was early detection. And then, my goal when I went full bore into this open heart surgery was I want to be back on an air pack in 3 months. And, I was back on an air pack in 3 months. And it was only because I had a commercial driver's license. I had to wait that extra month. Otherwise, I would have made it in 60 days. So my story is the firefighter physical that day saved my life. I had no idea that my body was craving for a better place to be. And that doctor in Cherryville, North Carolina, actually saved my life. And I just want to put that story out there so that you realize you may feel good, but as we age, things change. And with that, I'd like to ask a question to all our panelists. Would any of you, and I'll start with Rick, would any of you like to share how and why you became involved in advocating for first responder health and safety?
I'd be happy to. And let me just begin, when I was younger, I was weaned on health and fitness. I think it was in my DNA. My father was a health educator, very much involved in health and fitness and as an educator. So I think he instilled that importance. And throughout my career in the fire service, I continued that upward climb to recognizing the importance of health and fitness, and particularly how it applies to readiness for duty, which is kind of what we're talking about today, and the need for physicals. When I became fire chief and was in a position where I could actually influence and impact firefighter health through the administration of practices such as health fitness programming and physical evaluations, it became a goal of mine to do. At the time, Plymouth did not have any programming in terms of physical conditioning or health practices or medical surveillance for our members. So I've always been a very true believer in that my number one responsibility as a fire chief was to make sure that everyone goes home the same way they walked in the door. And when we talk about the fire ground, for example, when we hit the fire ground, your health risk becomes my health risk, and the health risk of your crew. So it became vital for us, and it was not an overnight success in Plymouth, I can tell you this, but the incorporation of annual medical evaluations and surveillance program is a reality. And that was probably just born through my early exposure to the importance of that readiness for duty and health and fitness. So it continues today.
Thanks, Rick, for sharing that. Dan, you have any to add?
Yeah, I would just say, number one, Rick was, we shared before we started here, Rick and I have known each other a long, long time and started in the same volunteer fire company way back when. But, Rick was leading by example back when not a whole lot of firefighters had any idea that they needed to take care of themselves. And I'm sure you remember those days of, smoking cigarettes on the bench in the front of the firehouse and, all that kind of stuff that was going on. And he was always, from the first day I met him, kind of leading by that example. I mean, for me, it was a combination of things. I mean, I think that once that I got to a certain point in my age where, as a fairly aggressive firefighter, I'd like to think, realized that my body was having a harder time keeping up with my brain. That was kind of a personal realization to me that, as we age, as you already spoke of, as we age, things happen to our body deteriorates. It's just a fact of life. And you cannot continue to perform at the same level on the fire ground, as you did when you were 22, now when you're 42, right? And so that was a personal realization of mine. Being a chief officer, being a fire chief, I've been a part of fire departments that either did not have a program or were building upon programs. And another part of it was realizing that in a particular department I was in at the time, that we had a kind of a problem, right? We had some pretty significant health issues in our own fire department on our career people. And so I kind of wanted to make that better, if you will. And like Rick did, you feel like that obligation to not only do it for yourself, but do it for everybody else. And that, along with the learning process of doing the research behind the stress and overexertion fatalities that we've faced in the fire service for decades through National Fire Academy and other programs that I took. It all just kind of came together, and I kind of took a big look out there at the time and said, there's not a whole lot going on here. I'm sure there's people out here doing things, but there's not really a concerted effort that I can see. And I wanted to be a part of that. So, it's a passion, and I'm sure Brittany and Rick would agree. I mean, we've come a long way, but we have a tremendously long way to go as well. I think the tide is rising, but there's still a lot of work to be done, and we're not going to stop until we get to the point where we can teach firefighters that they have so much control over their own health and the line of duty death rate in the fire service just by controlling their own risk factors.
Great. Thanks, Dan. And thank you for your dedication to that cause for sure. And Brittany, you want to chime in?
Sure. So when I was a firefighter, I was young. I was like probably weighed 120 pounds. And so for me, the impetus for like studying physical fitness, especially, and talking about firefighters and the importance of physicals came from like my physical challenge as a woman, as someone who's small in stature, and then from just being a small individual, male or female. When you're a small individual, like there's things that you do differently as far as tactics on the fire ground. You have different issues with gear, etc. So that got me really interested in the physical nature of firefighting. And then CPAT was another challenge of mine that I conquered. And so, learning more about physical fitness, physical activity, and then what that looks like long term. So we might be well trained as we come into the fire service. Perhaps we're young and we're really motivated, but then over time that might change. And so then like, what does that mean? And how do you kind of fix that as a firefighter? And then like, where do you go for guidance? And so those are some of my questions as I went to college. And then I mentioned that my degree is in kinesiology, which is the study of human body movement. And so I was able to really focus on movement specific to like tactical athletes, so military, firefighters, police, and of course fire service piques my interest because that's my background. And so then I got started, and just like everyone on the call has mentioned, there wasn't a lot of information, and there was a lot that needed to be changed or added to, or perhaps studied, so that we can provide some evidence base to why we're making these recommendations. And now I think we have a lot of that evidence base, but now it's like, okay, how do we get it out to the fire service? How do we make it relevant and accessible? And some of the work that Chief Kerrigan is doing is wonderful. Some of the work that MVFC is doing. And it's great to be able to get these things out. And so that's why we're here today, to share just the tiny bit of knowledge that we all have come across and make it more accessible to the fire service.
Great. And I would thank the subject matter experts for sharing their expertise and their experiences. Today's discussion focuses on annual medical evaluations as preventative and early detection, ready for laying out the groundwork for health and being able to safely and effectively fulfill your role as a first responder. Let's dive into this with some details. And Dan, I'd like you to start us off, if you would. There is a question. I'll start with Dan, and you could just go from there. The question: an annual physical is important for everyone, but can you walk us through why an annual medical evaluation is especially important for firefighters?
Sure. Well, I'll preface this by saying that I'm not intending to fearmonger or scare anybody when they say this, right? But as you said, everybody has health risks. Everybody in the world really needs a physical, right? But when I think about it, I think about that phrase "sudden cardiac death," and I think about how a member of the general population is typically better able to withstand certain health risks versus that of a firefighter. Because why? Because of the stress, the physical stress that we place on our body, right? All of our body systems. Because of when you combine that physical stress with the heat stress, the environment that you work in, and really moving your cardiovascular system up to a level where you're talking about, meeting or exceeding theoretical maximums in terms of heart rate and things like that, and being at that level for an extended period of time, right? These are things that we cannot withstand over time, as well as the typical general population can, right? So things like hypertension, high cholesterol, diabetes, obesity, personal history, all of these modifiable risk factors that many of us that have some or all of them or whatever, those are all heightened when it comes to firefighters because of the work that we do and how we perform that. So that's really why it's so important for firefighters, because we're already behind the 8 ball, I like to say. Like, for an example, if you have undiagnosed hypertension, maybe you're walking into the fire station with a blood pressure of 140/90 and you might not even know it, right? Now you're already behind, because when the bells ring and you go out on the truck and you go to that fire, as soon as the bells ring, we know our heart rate escalates. We know that we go up from there, right? So we're compounding those health risks just by simply being firefighters and being asked to perform what we perform. When you add to that the chronic health risks that we all face, I mean, we know that there's studies. I'm sure Denise will, or Brittany will mention Denise's study about, enlarged hearts and left ventricular hypertrophy, right? And these post-mortem studies that have been done on firefighters that have died of sudden cardiac death, the cardiac stuff. And we're finding that a tremendous amount of them, sometimes upwards of 80% of those firefighters, have been found to have enlarged hearts, right? So there's the chronic aspect of it as well. So to your point, early detection is key, right? Things that we can't even feel yet, that we don't know exist in our bodies. How else are we going to find out about them other than going and getting a physical, right? So we could obviously go on and on about this for hours, but that's probably tries to sum it up in a bit of a nutshell to get us going.
Mhm.
I think you're muted.
Thank you. I was trying to keep my background noise down. I'm sorry.
Yeah.
Let me go to Brittany. Brittany, I've got 2 questions for you, if you will. Bear with me. One, we now know that physicals are important for first responders because the job presents unique health risks. What diseases or issues are first responders more at risk for of developing? And the next question, what is the significance of detecting any issues early on?
Yeah, absolutely. Thanks, Chief. So Dan mentioned some of the issues firefighters face that are compounded above that of the general population, right? So we know that in general, the United States and globally, like obesity is an issue, heart disease is an issue amongst men and women. Not the most wonderful diet is an issue, and then these are kind of global issues, right? So then the fire service faces these things at kind of a increased risk, and so one of the leading causes of on-duty firefighter fatalities year after year remains cardiovascular disease. And Dr. Denise Smith, as Chief Kerrigan mentioned, has done a lot of work in that space. Sudden cardiac events account for over 50% of acute duty-related deaths among firefighters. I mean, by far the primary amount of firefighter fatalities. And so a lot of the risk factors that we talked about, so some of the obesity, the poor dietary choices, a lack of physical activity are leading to some of those increased risks for cardiovascular events, but also leading to that are the immense amount of stress that's placed on the firefighter. So some of that is the toxic environment. And even if you wear a breathing apparatus in an IDLH atmosphere, when you take that apparatus off, your gear is still off-gassing, materials from whatever was just on fire are off-gassing. And so you're still inhaling smoke and particulates. And a lot of the problem with modern construction is that the particulates are so tiny that we can't detect them with our modern technology, and we don't see or even feel that we're breathing them in. And so that can absolutely be a risk. So a lot of different things can lead to cardiovascular events. But cardiovascular isn't the only risk factor firefighters are facing, right? Firefighters are at an increased risk for cancer, both with diagnosed. Firefighters are at an increased risk compared to the general population for being diagnosed with cancer, and they are also more likely to die from cancers than the general population. there's a lot that goes into that. Again, there's lots of mechanistic things going on with chemicals and DNA methylation and the reaction to these chemicals in the body, but also firefighters are perhaps less likely to seek early treatment. And that's again why physicals are so important to detect things early. Survival rates for cancer are immensely more positive if detected early versus in the later stages of cancer diagnosis. In addition, firefighters face numerous behavioral health issues, such as increased rates of depression, post-traumatic stress, anxiety, increased suicidal ideation, and firefighters report frequent binge or heavy drinking. There's also high rates of sleep disorders among firefighters, and that can set up a whole chain of reactions that's not great for the body. I'm not getting enough sleep. And finally, lung disease is also high in the fire service. And lung disease is still high, even with the high usage of SCBAs. So we know the lungs are put at a stress with all of the different factors that are going on. And some of that is the heavy breathing. Some of that is the emergency response to a call. And so your heart rate is involved there. Your pulmonary function is involved there. So there's so much going on for the fire service. So that was kind of an answer to your first question. And then the significance, like I mentioned with cancer, there's so much significance in identifying diseases early on, rather than allowing them to progress into later stage disease. It's so much easier to medicate or correct these things before they become a life-threatening illness. Heart attack is a perfect example. If we can catch it, like Kevin said, and he had a quadruple bypass. I mean, if we could catch it even earlier than that, that'd be ideal. But if we can catch it earlier and do a surgical intervention before perhaps like a life-altering event like a heart attack occurs, that's ideal. And then it's also cost saving for the firefighter as far as medical bills and time off work. And then, like I mentioned earlier, cancer rates are the same way. Cancer is highly survivable. Most cancers are highly survivable if caught early, like in stage 1 versus in stage 4. And same with behavioral health issues, drinking issues, and a lot of things are so much easier to manage if we can catch them early on. So if we can get a baseline of a firefighter's health with a physical, preferably early on in the career, and then we can see them go throughout time, that way we can manage small changes in the firefighter's health and be able to intervene when we see something that's concerning. So that's really why it's so important to get the firefighter physical.
All great points. Brittany, thank you so much. I do want to say this. My cardiologist tells me that my heart and my brain don't communicate with one another, because I don't show any signs or symptoms, which scares him immensely. And so what we do is every other year I have a nuclear test, and I had a nuclear test last summer, we found something going on, even though I felt the same. I had no signs or symptoms, but by getting further testing and early detection, I ended up having 2 stents put in last December. But again, I don't feel any different. I don't feel any different with the stents in or not, but the tests show that I do need them. So it is, as Brittany and Dan and Rick are saying, taking action is critical. So let me now move on to Dan. And I've got a couple of questions, Dan, for you. When you go to the doctor, there's normally a standard procedure for physicals. Are physicals for first responders any different? And next, how should you inform your doctor that you are a firefighter, especially in the volunteer sector? And why do you need to ask them to look for any specific things?
Sure. So yes, the short answer to the question is, and the early detection is key for all of us, regardless of whether we're in firefighting or not. But the short answer to the question is yes, it is different, right? And we can all probably think of a time where we went to our family doctor and got a quote unquote physical that was probably more like an interview. Let's talk about how you feel for a few minutes. They'll take your blood pressure. You bend over, touch your toes, a couple other things, and you're good to go, right? Well, I think hopefully people already realize just from the discussion so far that that's not going to cut it for firefighters, right? So there's so many more things that we need to look at when we're talking about firefighter physicals, including, advanced blood work that would hopefully include cancer markers and things like that, right? We're looking at, especially for early detection, even things like your PSA level if you're a male, and why we need to be doing that much earlier than probably the general population. So because of the things that Brittany already said, what we're exposed to, right? Our lungs, how we're going to treat our lungs and take care of them, spirometry, baseline chest x-rays, right? Ultrasounds of all of your organs and major arteries, right, are huge for identifying abnormalities, masses, occlusions, things like that, that you might not, as you're well aware, you might not feel, right? So lots of things like that that come into play that take you over and above what I would call, a standard family doctor physical and push you into that NFPA 82 range where there's a whole list of components that ought to be included. We could be, Brittany might talk more about this later, but we could even be talking down the road not too far about calcium scoring for certain at-risk individuals, right? That
Oh, yeah.
the more we learn from these wonderful scientists and researchers, the more we know we can attack these things so early on. So there's so many different things that we need to look at, and that's not even concluding fitness assessments, right? Which really should be another part of that whole firefighter physical is an actual NFPA fitness assessment, even if it's a sub-maximal stress test and a couple of other things that you're doing to really check into your function and how deeply you're able to perform in these, and then of course the behavioral risk as well. When I was chief at my last department, we had already implemented the NFPA 1582 physicals, and I thought, what can I do now, right? And what can I do to expand that? And my next step was then to implement behavioral health assessments for the firefighters as well, anonymous, personal, preceding the physical, so that information could then be transferred to the nurse practitioner or the doctor, right? So that when you actually sat down one-on-one in a confidential setting with that doctor, they could talk about that stuff with you if you brought anything up in your assessment that needed to be discussed, right? So there's always something better to do or something more to do. But I think that in general, that's really why we need to do this. I'll add this to the mix because cancer presumption is so popular out there, and we're pushing it, and just about every state now has it. There isn't anything better than having a baseline of good health when you come in the fire service as a firefighter to help you in the future if God forbid you end up getting diagnosed with cancer. If you can prove through an annual firefighter medical evaluation that you were cancer-free and in good health when you came into the fire service, and demonstrate that track record through years and years of service, then if you're diagnosed with cancer, you have all that much more ammunition to fight for yourself, for your benefits, right? We can prove that I wasn't sick when I came in here, and because of the things that I was exposed to, it's likely that that's what caused the cancer. How are you going to know that if you don't get a physical every year, right? So there's a lot more to cancer presumption than just the end result of getting the benefits that we deserve if we're diagnosed. It's about trying to prove that it's what we do that caused it to begin with. So lots of things like that that come into play. And then as far as how do we tell people, our own providers and all that? Well, I think hopefully some of us are familiar with the Provider's Guide to the Firefighter Physicals, right? That it was born out of the SHS section years ago, and it's had many iterations and transferred to the First Responder Center for Excellence, and has become sort of the document, if you will, that any firefighter that doesn't have the opportunity to get a true occupational physical through their organization or their agency can take this, print it out and take it for free, and take it to their own doctor and sit down and have a discussion with them and say, here, doc, I'm a firefighter. These are the reasons why I need to have a more comprehensive physical. I know I could tell you many times I've been to a doctor and said, well, why would you want me to do a chest x-ray? You're just going to go, well, here's why. All these questions I shouldn't have to answer about my own health and why I want a certain test done or whatever. It's all summed up in that document right there. So worst case, even if you cannot get your own agency to get you a physical, you have this document available that you can take with you to your own personal physician to get them on board and have a better understanding of the needs that you have.
Great. Thank you, Dan. I appreciate that. And I know when I had my cardiac issue, I did bring the Provider's Guide in, and my cardiologist was very grateful to see that and shared it with his colleagues as well. So it's a great document, and it should be in your toolbox for sure.
They don't know what they don't know, right? Their family physicians and all that. They just don't. It's not that they're ignorant of it. They just don't realize what's all involved. And like I said, through the research and the science and everything that's been produced, we have great tools like this, and they're backed by science and data, and that's stuff that doctors understand, and then they can say, okay, now I get it. Let's
Right.
do this and this for you.
Bringing the
Yeah.
awareness is key. So, but thanks.
Yeah, couple, just a thought on what Dan was saying, and I'm retired, and I think what Dan said in some of the testing that he mentioned should carry through into retirement, at least in my opinion. He made a really good example of calcium score for heart scans, and that's big. That's some big stuff. So, and some of the other scans that we do. So, though we're talking active duty primarily today, for those retirees in the crowd, don't dismiss now that I'm retired, after X amount of years, that you're magically healthy, because this stuff stays with you. So, so I thought that was just want to mention that.
Yeah. And in the chat, I see some action and questions, and Sierra's one of our staff at the MVFC is kind of sharing some information. So as you have questions and things as we go through the process here, please just put them in, and we'll work on them as we go for sure. All right. So again, thank you, Dan, Rick. In that scenario that Dan was asked and walked us through, the physical is being performed at the doctor's office. However, some departments offer physical programs right on site. And so say what you want to start a program like this in a department, how should you proceed? And let's turn to Rick. How do we proceed to implement such a program?
I'm going to answer this in a rather roundabout way, but I will get to the answer, I promise. I think when we look at the organization, there's a couple of things to really take a look at. And the first, which I think is really the overarching, if you will, thing to look at is the culture of the department. And particularly is this department, and speaking of the firefighter, fire chief who would like to move the program forward, is there a history of progressiveness within the department? And is there readiness to change? And we know very well that firefighters don't like change. However, if it's rolled out, programmed out through a culture that is accepting change, and it's rolled out in the correct manner through programming and starting with the end in mind, and then being led properly, the chances of a successful program are very good. I think if you have a culture that is stuck and have not progressed to the point of recognizing the importance of a comprehensive fitness, health, and safety program for the department, it's going to be an uphill battle. Not that it's insurmountable, but culture plays such a large role in how we do things in the fire service. It really drives our business. And you combine that with leaders being able to lead with purpose and being able to show their personal support and advocate for this type of program is going to determine success of it. And then how it's planned and programmed and rolled out and communicated and all that. So I wanted to mention those three things: the culture, the programming, and the leadership, because they all come together. Think of it as a three-legged stool. And if you lose that cultural part, that stool is going to flop over. You might have great leadership. You may have inherited a department that just doesn't care about the health of their members. It's going to flop over. So I think that's a driving point, at least from my perspective and what I've seen in organizations. Getting to where do I go as a firefighter to seek this? And I think you start internally. And I do think that there's regional resources. I know in Minnesota, the state chiefs have some phenomenal resources on both physical and mental and behavioral and emotional health services, which are free. So you can get guidance through that. As a firefighter seeking to go to the 5 Bugle Club and say, hey, what do you think about this? I think that is as much to do about relationship building as it is coming to with solutions, for the fire chief, and saying, here's some ideas on health and fitness and physical evaluations and medical surveillance for our members, and going there. There are certainly national groups that we can rely on Dan mentioned the one study or the one paper that he held up for the medical surveillance and evaluations. But there's many more. The National Volunteer Fire Service has a heart healthy program. I mean, there's some things in there that are going to take a little time and research, but go to your city leaders, go to your fire leadership, and say, here's what it is, and recognize that programming isn't going to occur overnight. So the programming in my experience in working with other departments, and can be a very much an incremental and graduated approach to getting to whatever that goal is you want it to be. So come into the discussion with really being a pragmatic view at it, and being very realistic of what can accomplish as an organization, and what you can support funding wise, and go with that. But kudos to the firefighters of the world who are driving this from the ground up. And I've seen that. I've seen cultural change in my 40 years in the fire service. And sure, there's still a lot of pushback for medical surveillance and physicals. A lot of times centered on rationalization that, well, it's not going to happen to me because, as Kevin said, I was asymptomatic. I feel great, not knowing what's going on inside us. So kudos to the firefighters out there who are saying, hey, we need to really take an in-depth look at this and do it in a mechanism or a way that will work for our individual organization. So I hope that addressed that question in a roundabout way, but
let me ask you this, Rick. Say you have a leadership on board with starting, if we do our job today, some leadership might say, I'm on board, I'm going to start a physical program, but they don't know how to start. So what advice do you give them? Where do you begin?
What do you want to accomplish? What is it you want to do? Is it 1582? Do you want to combine it with 1583, which they link very well together? I think Danny had mentioned that. What is it you want to do? And it needs to be a little more defined than I want all my firefighters to have a physical, because I think you need to put in there, okay, I can do that. Do you have, is there an occupational health doc around? To me, I would lean that direction first. But beginning with that end in mind, I think is vital, and being very realistic in terms of what you can accomplish with your organization. I mentioned really briefly the culture. Is your culture ready for change? I mean that's a big deal. It really is. And I think you need to be that type of leader who is able to reach out to your firefighters and all across levels of the organization, and to be able to explain the why. But why are we doing this? What's the big deal? I feel great. I'm 66. May not make it any longer, but I'm 66 right now. So, and I think the other thing to factor in is, you need to be ready to answer some very fair but predictable questions from the membership. And, because if you're not ready to answer these and try to put in this as my way or the highway without an understanding of why we're doing this, it's going to be an uphill battle. There's questions, is it going to be a mandatory physical? Can I have it done by my personal provider? A gigantic one is, okay, now we have the test results. Are they confidential? Who will see them? Is this third-party custodial, or is it, the 5 Bugle guy saying, oh, we know it's probably not the best way to do it. Our evaluation's confidential. If I get a bad test result, what happens?
Right.
What happens to me? I mean, I've been a firefighter for 40 years. I still like riding a tailboard. I want to be a firefighter. What happens if I come back and say, well, Rick, you now you have type 2 diabetes. All right. So how does that impact my service in the community? And then who's going to pay for that? That was a sticking point with the organization that I had in Plymouth, and it wasn't the firefighters. It was the administration saying, we don't want to do this because this could, cost us money. This is back a few years. So, so things like that, being very transparent, kind of the word of the day, but that's very, very true. And you have to be able to lead with purpose and model behavior that you want others to emulate. So I think it starts there. You need to see, well, where's my funding going to come from? How am I going to pay for this? And I got to make sure I don't go too far off base here with the question. And, some of that funding may determine what the level of programming you have, and an incremental approach to, where we get to this end goal. We might start with, just that baseline that Dan said. And, and Brittany said, establish that baseline.
Thank you, Rick, for that.
If that's all you do, that's great. Sorry.
No, that's great information. Anticipate and be prepared. Basically, is you got to be prepared for everything in that situation. So I'm going to ask Brittany if you want to add anything into any of that right there.
I feel like that's such a loaded question because I think Rick really covered it very well, but that was such a big answer. But no, I echo everything that he was saying. And I love talking through all of these different things. I've seen some of the questions in the chat about how to get the volunteer fire service involved, how to get someone to pay for it, what are the recommendations. And I think having a continued conversation like this is so important to talk about what's worked well in other departments, how they've pulled it off, because there are absolutely volunteer departments that have leveraged physicals, however that works best for them. And sometimes it's partnering with another organization that is also offering physicals. Sometimes it's getting with the clinicians in your area and finding out who's a relevant provider for you to use. Dan earlier was talking about the relevance, especially of behavioral health providers, and finding folks that are relevant to the fire service, because that's important. But reaching out and finding education that you can take as a volunteer firefighter to your doctor, because oftentimes doctors are not familiar with the specific job tasks of a firefighter and how you may be at risk for certain things. So just starting with like the newest provider's guide that's come out and taking that as a starting point and saying, these are some of the risk factors and some of the things that the research community and medical doctors, occupational medical doctors are suggesting for firefighters. How do you think that works for me? And some of the things are based on age and some of it's based on family history. And so if we take together our family history, like your lineage, and then your family history, meaning your fire service history, and how things are relevant or more likely to happen to firefighters, and what you're at risk for based on that, I think then you can kind of make a collective decision with your doctor on what's important moving forward. So that's what I'll chime in with.
All right, and Dan, do you have any chime in?
Sure, I would just, it's hard to think of anything else, right? But I would say this, like, from a philosophical standpoint, right? I think one of the things that we need to do is we need to be better at promoting these physicals and these other health and wellness programs that we want to offer or provide for the firefighters as tangible benefits of the organization, whether you're volunteer or career or combination. This is something that I'm going to give to you that the general population doesn't get to have. As it's almost like a thank you. This is how much we care about you. We want to take care of you. And this is a tangible benefit of your membership or employment in this organization. So it's coming from a place of caring and concern, it's not punitive. It's not any of the things that we all hear, those excuses that you're going to take me off the truck if this or that, or, sometimes that has to happen because you have a serious medical issue that you might not even know about. But the goal is to get you fixed early so that we can get you back on the truck, right? And the other thing too is there's no rule that says if you implement an annual medical evaluation program that you have to do it this way. Rick mentioned a lot of challenges and barriers that you might have to overcome. There's nothing wrong with starting it out with doing it voluntary, then moving to mandatory every other year, and going from it's going to take time. Not every department's going to be able to do this starting in May. We're just going to do it and it's done. So it's okay, because if you're not doing anything and you move to a voluntary program that's annual or biannual or whatever, and then you eventually move to a mandatory, then you're still doing something more than you were doing before. And it's a positive, and it's going to eventually affect the younger generation of firefighters that come into your organization, which is the last thing I'll say is the fact that these young firefighters are taking such an increased interest in their own health and wellness and wanting to be taken care of. That's what's going to get us to a point where those of us that are on this call right now can say, okay, I can take a deep breath. I think we're getting somewhere now. We need to get to the firefighters that are just coming into the fire service, that are the future leaders of our fire service. Because if we can get them on board, then 10, 15 years from now, when they are leaders in their departments, this is going to be, it's going to be the rule, not the exception. It's just going to be something that we do. Kind of like back in the day when we didn't always have to wear air packs, and now we kind of are supposed to, right? There's things that take time in the fire service to evolve. That doesn't mean we shouldn't do them. We need to start now so that 10 years from now, we don't have to be talking about this so much anymore.
Great points. Thank you, Dan. I'm going to ask the three panelists if they take a look at the chat box and question and answer. I think there was one in there, but I want to address those that we can address. And I'm just going to kind of also want to mention that Dan and Rick have been working with the MVFC on a fitness course, and I would like the two of you to kind of speak to that. I know it may not be out live yet, but it's soon to be released. But Rick or Dan, do you want to kind of address that's the prevention piece, so tell us a little bit about what you guys have put together.
Well, it's I guess it came out as it ended up being a two-part course, if you will. And I think for my part, it was more about trying to give the participant a high level overview of, the important components of a comprehensive fitness and wellness program. What do you need to look out for? Why do you need to look out for it? And here's some ways that we can help you improve in that area, whether it's functional fitness in the gym, whether it's hydration, rest and recovery, nutrition, all of these things that not any one thing is going to make you better, right? We have fitness and wellness is comprehensive. So we have to have that approach. So for my part of it, it was trying to just give people a taste of what they need to be focused on, why they need to be focused on it, and some simple tips to hopefully get them started on a personal level down that road, regardless of whether your department does anything or not. The good thing about what we do in that area is that it's scalable anyway. You can do it for an individual, or you can do it for a 10,000 member department. It doesn't work any differently for me as it does for the City of New York Fire Department. It's all the same.
Right. And Rick, you want to add in on that course?
Sure. And as Dan mentioned, it was a two-parter, and my part was to take a look at it from creating a sustainable and effective health and fitness program. Primarily, how do you design and build that so that it works for the long term, it works for everyone, no matter what your organizational model is, and spoke to many of the things we were speaking to today. But really just in a succinct message is how do you design this program that's going to stick from a leadership level, cultural level, planning and management, is the whole 9 yards. But look at it from that viewpoint.
We thank you both for that. We're looking forward to seeing that roll out. So I'm going to turn to the chat box. There's some questions in here that I'll pick up, and if I miss anything, you guys help me out. But there's one from Michael Brown. If you only had a limited amount of funding, are there any suggestions for how to make decisions about who gets physicals? I know we heard alternating years in there from one of you.
Who, as in your ranks of firefighters?
I think that would be in the department. Who you only can give 10 of them, and you get 20 people. 10 a year for every other year. That's a possibility.
It's a possibility to alternate once every other year to get it started. And I think we have to focus on the firefighters that we would consider interior firefighters. If we get down to that level, we've got to make sure that the firefighters that are going into the burning buildings and doing that kind of work most frequently are going to be the ones that I would think we would start with. Now, Rick or Brittany might have a different idea about that, but
Yeah, I would agree, and I'd also look at your higher risk individuals perhaps.
There you go. Yeah.
Good point. Good
You know,
point.
so I think that might,
It's a dilemma, for sure, right?
it
It
is.
is. However, if you're doing something, again, if you're going to do something versus doing nothing, you're still
Yeah,
going in
but
the right direction.
real quick, I think there's things as a department you can do that don't cost money. You know, you can put literature out there on nutritional health. You can put, resources out there, oftentimes local, that will come in and do a pro bono. Let's talk about reading a nutrition label on this box.
Mhm.
What does it mean to me in my over? So there's a lot of things I think that sometimes it goes over our head because we think we have to go to this level. Well, let's start building that you can climb the ladder to get there. So
And
Great,
those
good
guide
point.
that guide that we shared with everybody, it's sort of designed for exactly that, right? Think of you as the person that didn't get to have a physical that was given by the fire department, but you can still go to your own medical doctor with
Sure.
this and do the same thing, right?
Yeah.
So, there's a lot of different ways to skin the cat, so to speak.
Great, great. Next question I see is, one of you spoke to this. What's the difference between 1582 and 1583? NFPA 1582 or 3?
1582 is the standard for fire department or emergency services physicals, the actual medical evaluation, and all of the background on that in terms of the different types and levels of injuries and return to work recommendations and things like that. 1583 is the NFPA standard for fitness assessment. So that's going to be the physical fitness part of it, the stress test, all the different the push-ups, the sit-ups, and the things that are baseline physical movements and exercises that would mimic some of the things we do on the fire ground to give you a baseline of where you stand, right? It's not necessarily meant to be punitive, I would say, but it can give a firefighter a better idea where they stand from their physical fitness standpoint, so that in a year, when that exercise physiologist comes back or you go see them again, they can look and see if you've improved or not. So they go
Great.
together, but they're not the same.
And then from John, and we're talking about our most precious resource that we have are our people. But John asked the question, do you have any ideas on selling elected officials to fund physicals for volunteers?
oh yeah, sure. And that was an obstacle, I know, at least for the department that I led. And frankly, it just took some time to help them understand that, you can offer your family physician, your private provider, physical. But I think there's that level of not knowing from the public administrator, city government, whatever organizational model you have. So it's a matter of going back and reinforcing the need. I will say this, don't throw the baby out with the bathwater. Okay, don't go with horror stories that, people are gonna die.
Children or die if we don't. Yeah.
Yeah, I mean, don't go
Doesn't
there.
work.
And that's just a personal opinion maybe, but, go with the facts, be patient, work the system. A lot of this has to do with creating trust and creating relationships. And sometimes that's what it really comes down to.
I would also offer this. It's an analogy that I've been using for a little bit now that can make people think about things a little differently. So especially when it comes to the chiefs and the elected officials, the fire service has implemented and used preventative maintenance programs for their apparatus and their equipment for decades. And there are reasons we do that. Okay. Name some of those reasons. We always ask the audience, the people we're speaking with, what are some of those reasons? Well, extends the life of the equipment, reduces costs, reduces downtime, all of these things that any bean counter is going to know is going to save them money. If we take care of the apparatus on a regular basis, it's going to cost us a lot less than if we wait too long and we have to fix a huge problem. The disconnect in the fire service is that we have not yet been able to convince those same people that the same holds true for us.
That's a great
The
point.
dollars and cents are there. The research, the data is there that shows that health and wellness programs reduce your costs, along with increasing longevity and health and reducing injuries and all that. It's there. So think about using an analogy like that. While we take care of our apparatus and equipment, we have preventative maintenance on all of that stuff. We're failing at doing it for ourselves, and that's what we need to do. And it's going to save us money, guaranteed in the first year we implement it. It's going to be an immediate return on investment, right? The other thing I'll just let everybody know is that we are actually working on a similar document to this that's going to be geared towards your elected officials. So the same folks that you fight with to get cancer presumption and all that, we're now going to take the approach and share with them, this is what the cost is of not giving firefighters physicals versus funding them and helping with at the state level and at the county level and at the local level. So we're going to try to give you, at some point, some additional resources to take to them and say, you've given us cancer presumption, but wouldn't it be even better if you didn't have to go down that path and spend all that money by just helping us fund the physicals in the first place? So we got other things we're working on.
Great analogy and great information. I think I'm going to take another question here from Rich. What is your recommendation for the frequency of firefighter physicals per the firefighter age? Ideally, we want every firefighter to get a physical every year. We know that, but he's asking if funding's not there, can we space it out depending upon age? That's his question.
So I think the physician's guide that Dan's been talking about and holding up intermittently, that's a great place to start because it does have some recommendations based on age. A lot of them tend to start around age 40. So it's recommendations for folks who are 40 and above. Of course, that coincides with the recommendation based on someone's personal history, their medical history, their family history, and then of course their occupational risks. So it might be relevant to begin screening somebody at age 35 with a relevant family history and also their firefighter history. But things like Dan mentioned coronary artery calcium scanning, the document suggests that starting at age 40 and then doing it annually, but also based on clinical judgment and like a risk profile of what you're looking at. There's other things like screening for cancer. A lot of the cancer screenings start at age 40. So you begin talking about a PSA for men around age 40. Colorectal cancer screenings should start around age 40. Mammograms for females start around age 40. So I would say a good marker if you're trying to kind of stratify folks by age is around 40. There's a lot of screenings that start being required or at least suggested by healthcare providers. So that might be a good age stratification place to start.
Good. And there's another question here. What if a firefighter does not provide a clear medical background, as in medicines and past history?
That's a really good question. And I think for me anyway, what I'm interpreting is like if they don't provide a full health history. And I think that's a whole nother question. But I think part of that is we need to focus on messaging and how important the messaging both from the department and from the doctor is to the firefighter. So some of the questions that were in the chat were about how reticent firefighters are to begin engaging in annual physicals because we're all afraid to get taken off the line. And volunteer departments are reticent to have their firefighters go through testing because they're reticent to lose folks from the line, right? The volunteer fire service as well as the career fire service is facing unprecedented staffing shortages. So I think it's important to talk with your folks. And just like Dan and Rick were explaining, like this is about taking care of your equipment. Your most essential equipment is your personnel. And so in order to keep them healthy and continuing to respond, we need to give them a little checkup every year, right? And so that will help them catch issues early rather than being something that like would potentially take them off the line, right? You don't want them to have a coronary event at a fire that will for sure take them off the line and they may not return home to support their family. So I think kind of selling it in that way and reminding them that this isn't a punitive thing. And I think the department, it's important to remember too, if you begin to implement physicals in your department, then it's important to also think through what happens when folks do pop positive for things. Like if they need to see a cardiologist, how does the department support that? And what resources do the firefighters have through our department or through other community resources to be able to go and get those follow-up care that they need to be able to answer questions that may have popped up throughout the physical. So thinking through like a continuation of care, connecting them to different mechanisms and folks in the community is important. But really that messaging of why it's so important to share complete and accurate health information with the doctor so that they have a full and complete picture of you as a firefighter and how to best take care of you, I think is really important.
Okay, well, that is awesome, Brittany. Thank you. Well, it looks like that's all the time we have for now. I want to thank the panelists, Brittany Hollerbach, Dan Kerrigan, and Rick Klein. I truly appreciate being with you today and sharing a wealth of information. Hopefully we'll get some action based on our discussion today. I think we had a great discussion on firefighter physicals and what actions we could take to be on put our best foot forward. We hope you could take advantage of the knowledge and resources from today, bring it back to the department, have some conversations, and bring the awareness up of why annual physicals are so important and how your department can implement a physical program. I also want to thank the National Volunteer Fire Council for organizing today's discussion. The council is the leading nonprofit membership association representing the interests of the volunteer fire, EMS, and rescue services. They provide resources, training, advocacy, and programs to help the volunteer emergency services thrive. You can learn more about the NVFC and what we do, as well as the access resources at nvfc.org. If you're not a member, I want to encourage you to join. It's just $21 a year, and it comes with a variety of benefits and the AD&D policy and free training and a virtual classroom. And we access voices, volunteer voices, member community, the NVFC first responder helpline, and much, much more. You certainly can benefit from the benefits of the NVFC. You go to nvfc.org/join. We'll include this video description and the links to the NVFC, the Center of Fire Rescue and EMS Health Research, the International Association of Fire Chiefs, Safety, Health, and Survival section, and the new NVFC fitness course featuring Dan and Rick. And if we didn't answer your questions, please email the NVFC Communications Coordinator, Sierra Olick. And thank you, Sierra, for all the work you did behind the scenes. Again, thank you, and all of you have a great afternoon. Appreciate you.